Thank you. Again, this is another issue that I have a lot of knowledge about through working at the mental health charity. Even though we don't provide youth mental health services, we get an awful lot of calls about it because people either call social services or somehow get through to the community mental health team and are fobbed off and are sent to our mental health charity. They're passed from pillar to post. There should be a no wrong door approach. It's really upsetting when you hear on the phone people, parents phoning up, and they just want their children to have the right diagnosis or the right care or the right support, and they're not getting it. So, what would we do to sort that out? It's a really difficult one, and it's obviously interlinked with the issues with BCU, Betsy Cadwallader, University Health Board. We would look at how would they provide mental health services and ensure that when they're outsourced, then they're outsourced properly, and there's proper service level agreements, and there's definite definition of what they want and how it should be provided. There should be accountability, there should be scrutiny, and if there should be people in charge, and if they don't get things done, then they need to be accountable.
Lavery. Next, Kristina Renshaw, Heritage Party, please.
Thank you. So demand has risen sharply, around 640,000 people, that's 1 in 5 people in Wales, now experience mental health difficulties, with increasing pressure among young people in particular. Yet funding around 820 million across all mental health services is spread across the entire system. This equates to approximately 1,200 to 1,300 per person per year. My approach is to focus on early intervention, so fewer young people reach crisis point. That means strengthening support in schools, improving access to early help, and making sure families and GPs can get advice quickly. If we get in earlier, we can reduce pressure on specialist services like CAMHS and shorten waiting lists. We also need to increase frontline capacity, not bureaucracy, more therapists, more practitioners, and clearer pathways, so young people aren't told you're not severe enough and left without support. Alongside that, I support greater transparency and accountability and funding, so we actually know how much is being spent on children's mental health and where it's going. More broadly, that is about recognising that when 1 in 5 people are struggling, we need to look at the bigger picture too.
30 seconds.
Supporting stronger families, healthier lifestyles, and real community connection. Because if we only treat the symptoms and not the cause, waiting lists will continue to grow.
Talk about our own focus indeed. We have Corin Jarvis, Labour Party, please.
Yeah, no, thank you. Great question. Again, I've personally seen the issues faced by young people when needing support from services. I've seen how the design of the systems can leave people falling through the cracks. And personally, I believe heavily in empowering communities, social prescribing, along with educating and supporting families and young people at the earliest point possible. Providing people with the skills and resilience to tackle everyday issues that they face before crisis point. Social media, bullying, money worries, climate change. There are so many challenges that young people and parents have to navigate today and every day. So as mentioned previously, obviously access to our NHS 111 Press 2 service for urgent mental health support is available for everyone. And our commitment to investing 4 billion in hospitals would include Wrexham Hospital, including obviously children's services and mental health services within that. We again are guaranteeing that people will be seen within 48 hours and opening community diagnostic services. But what we have got in our manifesto is that we will also further improve access to school counselling services and further embed a whole school approach to mental health and wellbeing. I do strongly believe in this because if you there are people and children and young people that will be struggling and they might not think that they reach the threshold for medical intervention, but if they are seen by someone that they know that that understands them early, then the prevention there is key, isn't it? Because school is a massive first point of access there for most children and young people, but also community, etc., etc. But thank you.
You're Corin, thank you indeed. And now we've got Richard Marbrow, Littleton Town. Thank you.
Yeah, I mentioned earlier the penny on income tax in order to pay to take the pressure out of the NHS, and I think that's one of the answers. But the other thing is for us to be honest about the global situation. So why do we have a mental health crisis? Well, I'm pretty sure COVID didn't help. I'm pretty sure TikTok's making it worse. And I'm pretty sure nobody's doing too much about that right now. And we probably need to, and we need to say some of that out loud. I'm a 52-year-old white man in full-time employment. The world is set up to make me happy, and I look at it and go, it's a pretty dark and miserable place at the moment. Donald Trump and his global enablers constantly making that worse. Maybe we need to say some of that out loud and say, yeah, actually, it's entirely reasonable to not feel great right now, and to turn around and go that a load of people that previously would have been on the edge are now being pushed into a mental health crisis. So I'm not interested in some of what I see, which is blaming young people for the increase in mental health and saying they're being too sensitive. No, we have not done a good job in my generation of making the world a better place for them all. So how about we turn around and take some responsibility for that and provide some proper funding from people like me to pay for the services that are now going to be needed to sort it out. How about we put some proper regulation in place in order to stop social media from destroying the mental health of young people, which is pretty much what it does every day in the search for ever increasing profits. And there are elements of the government at the moment that will say, well, that's economic growth. I don't think economic growth is worth the mental well-being of our young people. I will be completely and totally honest with you. I don't think the ability to serve adverts based on poor mental health is a very good way to go about building a decent society. So I think we need to be a lot more honest as a political generation in turning around and saying, actually, we've created a huge number of problems for young people, and yet we still have young people who are asking incredibly good questions, and is the only one with the energy to ask two tonight, so well done for that. So maybe we need to have a bit more faith in our young people, a bit more sympathy for our young people, not blame them for the mental health crisis that we see, and maybe do something about the root causes.
Marc Jones, thank you.
Thank you. 55% of 16 to 25-year-olds have approached their GP with a mental health issue. That is one of those stop you in your tracks stats, I'm afraid. It terrifies me for all the reasons that other people explained why young people are feeling so fragile at the moment. And I think in terms of practical things we can do, we have to avoid the cliff edge in terms of CAMS transferring into adult mental health services at 18. We need more integration to make sure that there's continuation of care. I think also, and it's been mentioned by others, prevention and early intervention is critical, because otherwise we will continue to have this sticking plaster approach where we're fishing people out of the river and we need to go upstream and find out why they're falling in the first place. It's absolutely critical that we understand the reason for that. And because of that, if Plaid Cymru is lucky enough to be in government next month, this is not a one-term project. This is a 10-year project. This is a decades-long project to transform the way we do mental health. We have to take it seriously. It's an investment we have to do. Speaking as a trustee of Advanced Brighter Futures for far more years than I care to admit, I know the work that's done at grassroots level. It's so important we have peer support for a lot of people, that people feel very isolated, people feel they can't confide. And I also think we need to be investing in culture, sports, other social institutions, so that people can feel better by joining in community. Social media is not very social, and we need to
Thank you, Marc.
This is so frustrating, and this is the last answer.
It is frustrating for ourselves as well, because it's really important that issue about mental health, and I know that Advanced Bites of Futures and TCC will be working together sometime along this year, having an assembly to talk about mental health issues that come up there. Can I say a big thank you? And then you can clap this time to the candidates, please.